Hello and welcome back to Specialness. I'm Jeff.
And I'm Kim.
And today we're going to be talking about another one of our reels that was put out on Instagram that got about 95,000 views and really brought a lot of tension up from the bottom of the ocean. The topic on this one was what's known as the pediatric cliff, where you're making that transition from the specialists that you're seeing and have seen for 10 years, 15 years, maybe.
24 or 5 years.
Maybe 20 plus years, and suddenly having to shift from the child pediatric specialist to the adult specialist.
Right.
That's a very stressful thing to go through.
Extremely. And we were not prepared for that. I wasn't prepared for that.
And why would you say you weren't prepared? What did you feel that you didn't know?
I just did not think about it being a problem because for, like I said, a majority of Cason's doctors, we had to move on when he was about 22. We still see one pediatric doctor for one more year, and then he'll be 25. But for 22 years, we've been seeing the same specialists and the same pediatrician, but the same specialists, which he saw a lot of different doctors, right? And you just get accustomed to that.
Yeah.
And you just kind of start to assume.
Well, you got relationships.
Yeah, and you just assume, even though I see adult doctors in the adult world, but obviously I'm neurotypical, and so I haven't really gathered. To me, the front staff and the nurses and the doctors I see, they've been fine. So it never really crossed my mind that when you go see an adult doctor who's a specialist, I just didn't see that they would look at you like, what's the problem?
Well, shame on you.
Right.
Because there was a lot of comments that were made on this reel.
Yeah.
They're just to sort of summarize some of the things that we said that seemed to elicit a lot of comments. One of them was that it felt like we were completely starting over.
100%.
I think I said this, that you go from lollipops and stickers to straight business.
And that one to me really kind of sums up the whole thing, because when you're in the children's environment, you get a lot of the, hey, bud, how are you doing today? It's a completely different vibe, a lot of times, because you're in a children's hospital, they have murals on the wall and their waiting rooms have TVs on, playing cartoons, and there's other kids in the waiting room running around, and it's just a completely different environment. You walk out that door into the adult world.
It's totally sterile.
And it's just, like you said, it's straight business.
You got a news channel up on the,
or piano, classical music's just playing. Everyone's quiet, reading their book or a magazine. Totally different.
Yeah. And I don't know why we didn't think, because that's what we're used to, but it didn't register. A couple other things. Guardianship, we'll get into that. Lack of understanding from all staff, basically from check-in all the way up. The feeling of judgment.
That's a big one.
I know, and that's something that you've talked about a lot. The looks that you get in the waiting room when our apparently neurotypical child is not behaving like the age he looks to be.
Because we're not in the lollipop sticker world anymore, like we just said. I mean,
and I just want people to know I like getting lollipops and stickers, but
it's fun.
Yeah.
I'd rather go there any day than sit in a sterile, cold, boring doctor's office.
And then we get into the nurses and doctors that are questioning us, which I think goes back to judgment. But there's a very specific reason why the questions are frustrating that we'll get into. So let's talk about some of the comments. And some of these are direct comments. Others are sort of a summation of a lot of comments that were similar.
Right. Yeah. These are kind of the ones that got the most likes, or, oh my gosh, I agree, or
reactions.
That's 100% true. So we kind of pulled from that.
This one's pretty short. It's shocking and devastating.
Yeah. That one got a lot.
There was a lot of...
Yes, and it goes back...
And we know what we mean by the thumbs up.
Yeah.
But yeah.
But that goes back to what I was just saying, that nobody prepares you for it. Not one pediatric doctor we have seen ever mentioned, oh, by the way, in X amount of years, you cannot be here anymore and you have to see a different doctor. And this is what's going to happen. Not one doctor. And like I said, we have been seeing doctors since Cason was, besides a pediatrician, gosh.
Right. We've been seeing
2?
specialists since he was, 3.
Young,
2? Yeah.
young. And not one of them said, there's going to be a transition here. Let me help you do that. Nope. It's a silent, nobody talks about it.
Well, it's like everything else. I think that's why they call it the cliff, because no one prepares you. No one, you don't get notifications from the state about waivers you should be on, or programs that are available, or the easiest way to apply for your SSI benefits. None of those things you have to work to get them.
Right.
Or even pay someone to tell you how to do them.
Right.
And that's just unfortunately something that we have to live with. But it's certainly, you have an expectation, I think, because of, generally speaking, how well your child was treated by their pediatric specialists, that the adults are going to at least be respectful, at least be understanding.
And not just all doctor-like, business-like.
Well, and why is that? Because when you make that transition, the first thing you do is you send the records over.
Right.
So let's talk about that, which gets into nurses and doctors asking questions, because maybe I'm wrong, you tell me, but I think we're batting a straight 0 on first appointments with adult specialists, where we walk in the door and, we're going to skip over check-in because we're talking about the doctor now. When we go into the room and the doctor walks in and says, "Oh, hello, so what are we doing here?"
Right.
They haven't read the records.
And if they have, it's been a quick skim. Again, we've been seeing a doctor for 20 years, this particular specialist for 20 years, there's a lot of information on Cason, right?
Your folder's it's like that thick. Yeah.
He has multiple folders.
That's true.
A lot of these doctors.
Sorry, I didn't mean to cut the folder short.
Yeah. So to expect this new adult doctor to have spent the time to look over his multiple charts and all the files they sent over, to be prepared for his visit, was, to me, extremely shocking that wasn't happening. I mean, like I said, they might do a quick skim, but then they'll be like, has he done this? Has he done that? Has he been on this medicine?
Well, let's even back it up to the check nurse who comes in first, right? And the question they ask is he on any medications?
Right. Right.
Of which we go, yeah, it's all in the records. He's taken like 20 medications.
Right.
And you finally just reached a point where you just carry one with you.
Yeah. I bring his 2-page medicine list at every appointment, even though we've seen these adult doctors multiple times.
And even though it's in the records
the records, they still ask. A lot of times it's not even, which they need to ask, is he still taking this, or any medicine changes? It's not even that. It's the question, is he on any medicines? And I want to just look at them and say, you know what? We've been here 3 times or 2 times. Okay, the first time, read his file, read his chart. So I just kind of get this look and I pull out his med list and hand it to him. And then they look at me and they're like, oh.
Yeah. It makes you wonder why the records were even sent over. And it's even more frustrating when we get to that second, third appointment, and it still feels like nobody knows who you are. I think there's a lot of reasons. We'll get into, we'll discuss some of our suspicions about why it's that way as we get on, but it's frustrating. This is a very specific comment that I want to read in toto. This is absolutely true. It says, "For us, it's specific, and they're in the spina bifida world," they said. "There are so many expert spina bifida pediatricians, but so few adult physicians who even understand the basics. Children with spina bifida turn into adults with spina bifida as they have a typical life expectancy, yet there is no true transition or consistency of care."
Right. And I wanted to put an amen, hands up, hallelujah. Yeah, that is why we're doing this episode.
Yeah.
Because I don't know why doctors think that just because they turn 18, all of their issues go away. In our situation, Cason has a very, very rare genetic deletion that no doctor knows about, not one. And I don't fault these doctors. Even the pediatric specialists have never heard of it. So I don't fault them for not knowing or understanding it. But what I struggle with is, why do these doctors in the adult world assume, oh, they're 18, they're adults, they don't have autism anymore, they don't have cerebral palsy anymore, they don't have Downs anymore, they don't have rare genetic deletions anymore, they don't have heart trouble anymore, whatever. Right. I don't understand that mentality, because in reality, they don't think that. They understand it, but there is no, if they understand it, no one is doing their job of let's bring these two worlds together.
Well, it certainly doesn't appear they're making the connection.
No.
But the only thing I can think of is that they're expecting some level of maturity to have occurred. And, I'm sure that that's true for some patients with whatever their
right. But if you
difficulty is.
If you have a nonverbal child, most likely you're going to have a nonverbal adult.
Right.
And so why do these doctors not communicate with each other, pediatric to adult? Why is there no communication? And B, what in the world, how did this adult medical world, how do they not even comprehend this? That all of these kids that are being diagnosed with whatever it might be at a young age, they're eventually going to grow up. And that is where the frustration is for parents like us. Yeah. That just because Cason turned 18 or 20, or he's next year, be 25, and we have to go see a new adult cardiologist, this cardiologist has to understand that it's not just, oh, he's 25, he's better now, he doesn't need to see me,
Or he's capable of telling me what's going on, which I think leads really well into this next comment, because I think we can kind of get in a little bit here and how we can manage this situation that isn't our fault, that is frustrating over and over again. And it's obviously it's not all doctors, but there was a lot of comments here that it's prevalent. So one of the things here is that as you start getting into these questions, that you're quickly and constantly seen as overprotecting, though you're just providing necessary support to ensure that the important medical appointment is successful.
Right.
And that's because immediately, and we're gonna back up to check in here in a minute, but we've already gone through a frustration there. Now we're in the room. We've dealt with a nurse who's asked things you feel like they should already know, and now the doctor is coming in and they're asking questions directly to their patient.
Right. And let's back up a little. The nurses do it too.
Yeah.
The nurses will ask Cason whatever question. Are you still taking this medicine? Or what dose of this are you on? And then I have to jump in.
But they're asking them.
They're asking Cason. However, the nurses, in just our experience, the nurses catch on faster or don't have as much of a problem with me than saying, oh, he doesn't understand that. You can talk to me. I'll answer the questions. Most of the time they're pretty good about like, oh, okay. And they'll just continue asking me the questions. When the doctor comes in, that's where I think like this comment was coming from, where they come in and they, will shake Cason's hand and say, hey, Cason. And Cason just kind of says hi or sits there and stares at him.
Or maybe even Mr. Cribbs.
Or Mr. Cribbs, right. Yeah. And then they instantly sit on their stool and pull up and look right at him. And I'm sitting in the chair, almost like these doctors are like, I'm not there. They're oblivious to me, and they start talking to him. And he instantly starts getting tense and stressed because I know what's happening. And then I'll answer because Cason won't understand, right? He won't understand a question. And I'll say, oh, he's having X, Y, and Z symptom. Or no, he's still taking this medicine. And it's happened multiple times with different doctors. And they'll look at me and be like, he can answer. He's an adult.
Yeah, and that leads into, and I'm going to let you share that anecdote a little further here, but someone here says, totally relate. Took adult nonverbal son to the doctor. So I was explaining his symptoms, and the doctor turned to me and said, how would you know how he's feeling? And how can I treat him if he can't tell me his symptoms or how he is feeling?
Right. Now, as a mom, sitting at that appointment, would you not be really mad? Because the doctor's not even addressing the fact that the adult child is nonverbal. And the fact that he says to her, how do you know how he's feeling? Well, because you want to look at him and say, you know why I know? Because I've been his mother for 20 plus years, and I know when he acts like this, he's probably feeling this. Or we're the parents. We know.
Right. And you've known them 3 minutes.
Right. And you just walked in and you maybe have glanced at his chart. But when doctors say things like that, as a mom or if a dad, if you're at the appointment, it's so infuriating because they're looking at you like, I don't know if it's that they're better than you or whatever, that you don't know what you're talking about, but we're the experts.
Yeah.
We're the experts. And especially if you're dealing with something rare and they don't know about it. And I have to pipe in and say...
That's our case, right? Because
Yes.
when we have to say, well, he's got 15q25.2, they're like, I don't know what
I don't know what that is. You must have made that up. They don't all say that. We've had that a couple times. But
they say, I'll have to research that.
Yeah, or they'll just kind of look at us and stuff. But it instantly sets a different tone.
Right.
Because they're like, and it's not to make them feel stupid for not knowing this rare genetic deletion. I don't fault anybody, but it's how they proceed from there. But to tell this mother who has an adult nonverbal child,
right,
how do you know? Is so judgmental, and it's putting down that mother.
Yeah.
One time, Cason was over the age of 18, and we had to go see a special physical therapist. I think she was specialized in neuromuscular patients. And again, he was over the age of 18. We already had guardianship. I had the papers with me. We fill everything out. We're sitting in the waiting room, and she comes out and says, okay, Cason, you can come back. Well, I instantly jump up to go with him because when do I not go in an appointment with him, right?
Because you're his legal guardian. I mean,
right. Well, because I know he's not going to do anything for himself, so I have to be there. Well, I stand up, and she's like, no, you don't need to come back. This is just for Cason. And I said, no, I need to be there. And then Cason's looking at me with that absolute scared look of,
I'm about to go back there by myself.
Don't. Yeah. And she finally was like, okay, you can come back. So I go back. We're in a room, and she's sitting right by Cason, and she starts asking him questions. And the questions she's asking him are all very adult questions, medical type stuff. And she's treating him as if he is a neurotypical, I think at the time he was 19, maybe even 20. And so she's looking at him and talking to him and asking him questions, and he can't answer.
But he doesn't understand what she's saying.
He didn't understand.
Right.
So I happened to say to her, he didn't understand the question, so, I can help out. I was trying to be nice about it at first. And she was like, no, he can do this, Mom. And I was like, okay, this isn't going to go well.
She called you Mom?
Yeah. And then she starts back with Cason. And at this point, Cason's very upset. Like, what she doesn't understand is the more she's going to push him, it's not going to end well for her. Because watch any other episode, what happens with him. He can become very verbally, I would say, aggressive. Agitated, tell her she's stupid and all this kind of stuff. So I just am sitting there, and after she said that, he can handle this, Mom. And of course he couldn't. And she continues asking him questions, and I see him getting more and more upset. So I answered for him, and she stood up and came and put her finger in my face and was like, you will not answer these questions. He's an adult. He can handle this. And of course, I wish at that point Cason did say something to her like, you're stupid, or,
Well, I can imagine what you wanted to say.
Yeah. And he just sat there, and he was, he just had that look in his face, and she's looking at me like I'm not a nice person. And so I make the decision. I could have said something bad, or I could have just gotten up and left. But
And if I may, there was someone who actually made a comment along these lines who said, and thank you for this, you're better people than me, she says, as I do speak up and make them well aware of how shitty they are.
right.
So,
And I could have said something like that.
Yeah.
Or I could have picked up and left.
Right.
Which maybe looking back, I should have just said this isn't going to work and left.
because
but I
you didn't go back.
We did not go back.
Right.
But I sat there and let her continue her questioning of Cason and didn't say another word. And she got nowhere with him because he doesn't know the answers.
Mm-hmm.
He's just sitting there staring at her. He's getting mad. He's looking at me. And then she would look at me eventually because we're just wasting everybody's time. And I just sit there and smile at her. You told me not to say anything, so I'm not going to say anything. And eventually she just kind of gave up and she's like, okay, well, I'll write a report and we'll figure out like how many sessions he needs. And I said, okay, thank you. And we walked out, never went back. But in the meantime, we get in the car and then Cason unloads.
Right. And then it's your problem.
Then I take the brunt of
Right.
that. And he's mad. And I'm never going back to her. And she, and that experience lays the groundwork for every new appointment we go to. He remembers her and that experience. And he says, is this going to be like that? What if they don't let you answer? Do you have the guardianship papers? I don't want to do this. And it's sad to me that he would be in that situation, because if he was 8 and we had gone to see her for the same neuromuscular issue, she would have never expected him to answer those questions. She would have been like, hey, Mom, when did this symptom happen? Or can he do this? Right? But because he looks like he's 20, right? He looks like an adult. She assumes that mentally he's an adult. Even though I'm sitting here with the guardianship papers and all that stuff, I don't understand why she's not making the connection. And it says on his paperwork he's IDD, that he functions as like a 7 or 8 year old. So
Yeah.
Again, did she just skip over it? Did she not care? Did she want to be in the right? I don't know. But that's just one of the experiences we've had when he turns 18 of what we've had to deal with.
And I think that touches pretty heavily on what you've talked about feeling judged,
Right.
Right. And
Because like I said, I am his mother. I have done everything for him and with him and helped him. And we both have fought for services and stuff, but I am the one that you have been to some doctor's appointments. But let's just say over the last 24 years, it has mostly been me.
it has, yes.
And I know what I'm talking about. I know Cason's diagnosis is like the back of or the front of my hand, whatever that saying is. I don't know what it is, but I can talk about it until I'm blue in the face. I know what medicines he's on. I can tell you the doses. I can tell you everything about it. And when he stopped one and I don't need to look at it because I live it, right?
Mm-hmm.
And then for some person to walk in the room that does not know him, does not know me, can instantly think, she's just an overprotective mom. She's a helicopter mom. He's over the age of 18. He doesn't need her here. And he can answer. Is so frustrating.
Well, it's questioning your job as a mother.
Right. Because again, in the neurotypical world, you don't get these questions. Because when your child is young and you go to the doctor, you're the parent and everyone knows you're the parent and you're going to answer. And then if you're lucky to have a completely healthy neurotypical adult when they turn 18, maybe at 18 you go to a doctor appointment with them, but they won't let you, with HIPAA and stuff, unless your child signs the form that you are able to talk to them, they're not going to let you back in the room and talk. And so your adult child grows up and can handle those appointments by themselves, but not in this community.
And I think, considering this was a specialist, a neuromuscular specialist, I can't imagine that this is the first time she has come across someone like Cason who has a difficult time communicating or talking about how he feels.
Right.
It's just amazing to me that, because she wasn't like 23.
No.
She was a seasoned professional.
Right.
It's just amazing to me that at that juncture in her career, she hadn't developed some aspect of bedside manner about dealing with this population.
Right.
It leaves me without words.
Mm-hmm. Me too.
I think that now we kind of skipped over this because we talked about records and how they don't read the records, but the tension starts at the very beginning.
The minute you walk in that door.
The minute you walk in the door, this was a 4-word comment that was much commented upon and reiterated. No one understands guardianship. I couldn't have put that better myself, because it might as well be written in a foreign language.
Right. That's a good way to describe it. Because if you have a adult child, who cannot make legal decisions, any kind of decision really, you have to get guardianship when they turn 18.
And we're going to do an entire episode on guardianship.
Right.
But because it's stressful, but it's something it's very helpful to have.
Yeah.
In our situation.
It's easier to get than Social Security and all that kind of stuff.
Well, it's way easier to get than
Right.
Social Security. But you wonder why you have it when
Right.
you walk in the door.
Because 9 out of 10 times I go, no, I would say 9 out of 10.
9 out of 10?
Mhm.
I was going to say 9.8
Okay,
out of
maybe
10.
9.8.
Yeah.
Yeah. We get to the front. Cason and I walk up. I say, we're here for Cason's 4:00 appointment.
Mm-hmm.
And they instantly talk to him.
May I see your driver's license?
Even if we have been at this doctor before.
Mm-hmm. Yeah, I understand it if it's the first time. We expect this
At the first time.
rigmarole the first time.
But the second and third time of seeing this adult doctor, it should be somewhere when they pull up his name. It should be, I don't know, it should be somewhere on their...
On the front page, he has a legal guardian.
He has a legal guardian.
Yeah.
But they don't. And they instantly start talking to him. Yeah, can we see your driver's license? He doesn't have a driver's license. Can I see your insurance card? He doesn't have an insurance card. So I look at her, and I always bring the guardianship papers. I have learned my lesson on that.
Mm-hmm.
Even if I've given it to him every single appointment, I have to bring it, because odds are they don't have record of it. So I say, I'm his legal guardian.
Oh, they have record of it.
Somewhere.
They just don't see it or
I
look
get
for
that,
it or
they
whatever.
don't put it in his chart. I don't know what they...
Well, we have talked, I know you have told me that you've worked with multiple doctors where they will call before his 4th appointment
and ask us...
and they'll say, do you have a copy of the guardianship agreement? And we're like,
Or-
yeah, we brought it. We have sent it. We have emailed it.
Or what's interesting is a lot of times, these specialists will call to confirm his coming up appointment.
Right.
And they ask for Cason.
Oh, yes. May I speak with Mr. Cason Cripps?
Right. And I say, well, he's not home, but I say, I'm his mom and his legal guardian. Oh, well, can he call us back? And I'm like, okay, no, you can't.
Well, you want to say, did you just hear what I said?
Right.
I'm the legal guardian.
Right.
Right.
And I try to be nice, because maybe this is this person's first day of work. I don't
Sure.
know. But again, it should be noted when his name comes up on the appointment, there should be something next to it that says he's special needs and he has a guardian.
Yes.
So don't ask for him on the phone. Or when they call, if somebody calls with lab work results or something, even though I was just at that appointment 2 weeks prior,
Mm-hmm.
they'll call and ask for Cason.
Yeah.
Because it's a different nurse that is calling with the results, or a different front desk person, whatever it is, they ask for Cason.
Yeah.
And it's hard not to stay nice.
I mean, it's comical to talk about it now, but at the time, it's
Very frustrating.
yeah. I mean, you can't comprehend how it's possible because they have it.
Right.
And I remember I took him to a doctor. I know I don't take him to a lot of doctors, but I did take him to one, and I had a copy of the agreement with me. And, I said, they did the same thing. Cason, I see your driver's license. And Cason said, I don't have a driver's license.
Right.
And I said, I'm the legal guardian. And she goes, what? And I said, yeah, here's a copy of the legal guardianship. This was the first appointment. And so she took it from me, and then she said, hang on. And she goes and she talks to somebody. She comes back and I said, okay, we've we've scanned this into the records. I go, great. Okay. And then she goes, okay, Cason, so you'll be and I said, wait, hold on. What are you doing? She goes, well, I'm just telling him the instructions for when he goes back. I said, well, he's not going to go back by himself. She goes, well, he's 18. And I'm like, wow. I mean, why did we just have this exchange?
Or you give them the guardianship papers and stuff, and then they say, in order for you to go back, he's going to have to fill out this HIPAA form.
Right.
And I said, no, because this guardianship bypasses all of that. And they just look at me like I've got 7 heads, and they're like, really?
And I appreciate the HIPAA laws. I mean, I'm not advocating that we get loosey-goosey with our medical information, but
in this situation, when somebody presents their guardianship papers, they need to know what they are and not just look at us like, what? And maybe these doctors' offices need to be training their front desk people way better, because I would say the majority of people that come in to see this particular specialist or whatever, I mean, yes, some like elderly parents, and you might be the legal guardian of your elderly parent. I see that they might understand that different than how they would look at our situation. Because again, if you are taking your elderly parent who has trouble walking or has had a stroke or whatever the situation may be, that front desk person can instantly make out, oh, they might be incapacitated in some way or whatever. But in our situation, like we've said, Cason walks in the door, first glance at him, you're not going to think mentally he functions as a 7 or 8-year-old. You're not going to think it. And so they instantly start talking to him, and it starts the whole appointment off on the wrong foot.
Well, and, I know we kind of did this out of order. It was based on the comments. I mean, when you break this down, if you put it in order, you have to feel like you have left that first appointment and you just don't really know that you accomplished anything. Or in your case with the muscular PT, I am not going back.
Right. You have to then you have to start over and find a new one.
Right. Yeah. Which brings us to our next question, the last comment that really got a lot of traction here. It's very disappointing that not one of the pediatric doctors, specialists that we see would provide a referral to an adult provider.
Mm-hmm. That is extremely true. I can say I would say his neuromuscular doctors that he saw were very good, very well known here in Dallas. Mm-hmm. They did refer us to who they would recommend, kind of.
Well, they're very careful because they don't want any. I think what it comes down to, and this is, I mean, I understand it, but it's very frustrating for us. I think that there is some sort of a code among the pediatric and adult care that you want to be careful about showing favorites to the next level up, and so they.
But I'm not even sure from the pediatric perspective that, because what Cason has is so rare.
Well, yeah.
That she was kind of like, well, I would send you over here, but it's not going to be the same. And it hasn't been the same. In fact, we're not seeing this one anymore. We're on the hunt for a new one.
Right.
Mainly because first appointment with her, first we had to see, it's a teaching hospital, so you see all these residents and you go through all this stuff. And even though it's not in the file, I mean, they're not reading the file and stuff. She comes in and she basically says to me in a nice way, really, what do you want me to do for him?
Oh, yeah. Let's go deeper into that. That was a specialist
for neuromuscular
that we were referred to, right? And she was kind of like, well, what do you really want me to do? And I wanted to be like, well, I don't know, because we've been seeing the pediatric neuromuscular doctor every 6 months for the last how many years? Yeah.
And this is why we see them that often. And she's like, well, he's already on, the gabapentin and stuff. And I was like, well, you could oversee that. But in her opinion, either Cason wasn't severe enough for her,
or too chronic
I don't really know what it was, but
yeah.
she was very, I mean, she literally, she, kind of did a quick check of him. And then she looked at me and she goes, well, I mean, if you want to see me, I'll see him. And I'm like, I didn't say this to her, but it's like, I don't want to be at a doctor that is acting like,
You're doing me a favor,
Yeah, because again, nobody exactly knows why Cason has
Right.
the neuropathy and stuff and the pain that he does and why his swallowing's off. And nobody really knows why. That's why we see her to kind of monitor his progress with all of that.
And it's nice to feel that she doesn't really care to know either.
And when I told her that he's part of the rare disease clinic and study at the hospital she's at, and she was like, oh, that's good to know. And then she just kind of looks at me. So needless to say, we were supposed to go back for his second appointment with her when he broke his ankle. And good thing he'd broken his ankle because I could just cancel that appointment. Have not found another one. This particular kind of doctor is hard to find. But I need a doctor that's going to listen to what the previous neuromuscular doctor and all the testing he had done with her for all those years and not look at me and be like, what do you want me to do for him?
Yeah.
I don't know. You're the doctor.
Well, I mean, just even discussing this has been exceedingly frustrating, and I haven't done 90% of the appointments. So let's try to impart a little wisdom here to our dear listeners, because this is a problem that is going to persist.
Yep.
I think we can talk about why it's like this, and then we can talk about how we can deal with it. And let's just talk about why it's like this, just to sort of reiterate some of the things we talked about. First of all, unfortunately, I think we have to assume that in a lot of our cases, we're just not their typical patient. We require a higher level of care / expertise / attention, and maybe that's not great for business. There's just no training in medical school.
For this population.
So I think it's going to have to be something that is innate in them anyway. And by the way, we've had some doctors that have it. I mean,
it's not every single doctor,
not every
doctor out there.
I mean, we recently raved about Cason's ankle surgeon. And,
he's amazing.
How amazing he was. I think that there's obviously, because there's not a focus on this in medical school, there's probably not a focus on it in the training of their own staff.
Right. And what's interesting too, though, when I've gotten to know a lot of Cason's pediatric doctors very well, and I've asked them point blank before, why did you go into peds instead of adult?
Right.
And they all say the same thing, really. We just love children, and I couldn't work in the adult world. That's too different. I really they all you get called to one or the other, right? So I kind of gather that these adult doctors specifically chose adult medicine for a reason. They didn't want to deal with children because it's a completely different ballgame, right? Yeah. Just children's behaviors and all that kind of stuff. So there's a reason why they decided to be adult cardiologists and not pediatric cardiologists, right? It's a temperament, it's a personality thing, it's a preference. And so when our population comes to see them, I think it throws them off a little bit because they're like, well, they are adults, so I have to see them, but their temperament, their personality belong more over in the pediatric side. And this group over here doesn't know really what to do. It's almost like they're fearful of our population.
I think that's a big part of it. I think they see a liability issue. I think it comes with more risks. And I think they make a business decision that it just may not make sense for them to do this. And that's really sad. I understand that there's a reality to that, but I mean, it's just, obvious common sense from a business perspective that if you can treat, 6 patients an hour and crank through and bill, and then I have a patient that I have to spend the same amount of time I have to spend with 2 or 3 patients, and it's more complicated, and it's taking up more of my time and my nurse's time.
And, they might have a behavior
and
problem.
What if they have a reaction to the Medicaid? I mean, I see why they do it. It puts us in a really bad situation.
Mm-hmm.
It's why when we find a doctor that works for us, they're like gold.
Yeah.
And that's why I think rather than talking to your pediatric specialists about who they would recommend, personally, I would ask people in the same situation, whether that's on a Facebook page or wherever your community is.
Right.
I'd be asking them who they're seeing.
If you know anyone that's older, that's a little bit further down the line than you, I would ask your peer group, because I am as quick as anything to be like, oh my gosh, this doctor is amazing, was so amazing with Cason. And then we have several that I have sent that to people, and I have helped, I swear, build their practices because I've told so many people about them. But I'm just as quick to say, do not step foot in this person's office, because they don't get you. They don't understand your child. Don't waste your time or their time.
And they're not going to make an attempt to.
Right.
I think and just kind of quick, I think one of the other reasons is I think there is high turnover, in the front, especially in the front office of these practices where you're talking about reception, people are answering phones. I think those positions turn over a lot. And therefore, I think that's why you run into those problems at check-in. So we're all dealing with this. Some of us have to do it tomorrow or 4 times next week. So at the risk of saying things that everyone would innately understand or would think is common sense, let's just try to talk about the best way to handle these situations, because they're going to happen. Let's say that you're in a situation like you were with that PT where you're pretty sure you're not coming back. So rather than thinking about we've established some sort of a relationship, but we're still having some issues, what's the best way to handle a situation where this isn't going to work out? We got someone said, just tell them off and walk out. What would you recommend?
I would, if I was in that situation again with Cason, I would look at her once she's, gotten mouthy with me. I would have looked at her and just said, you know what? I just don't think this is going to work out. Thank you for your time. Cason, let's just leave.
Yeah.
And then if it was more of a problem that needs to be addressed, then I would call back the next day and ask for the office manager and be like, okay, I really need you to understand what happened here, and that she needs to be talked to about what the point of guardianship is. And yes, the patient's over the age of 18 and legally supposed to answer, but that's what guardianship's for. Because I guarantee you, she herself isn't telling anybody why we aren't pursuing treatment with her, So, I mean, if I would have, like I said, said to her, and
you're not demanding she be fired or anything like that.
No,
you're just saying, hey, there's a learning moment here that's available.
Yes, and if it's happening with just her, I would think it's kind of throughout the whole practice where there's not a lot of understanding here, because you can see that in any practice. I can think of one adult practice where almost every time we go, it's not just the front desk. It's literally every step. It's the people doing the labs. It's, the PA or the nurse practitioner and the doctor. It's the whole thing. So,
and I bet you that the person who said, told him off and walked out, I bet you that felt pretty good.
Yeah.
But I think and I'm not saying that was a bad decision. Right. I can certainly relate. But I do think that if we are all trying to truly advocate, not just for our own kids, but for our whole population,
and educate,
we're going to have to reach deep down and get patient and try to fight through this. Because the reality of what you just said about that, you would call up and you'd say, very candidly and very honestly, hey, there's an opportunity to educate your staff on this topic. there's a good chance it never happens.
Right.
But it might.
Right.
And I think that that's the shot we have to take as advocates for our population, is we have to assume the best will happen as we try to advocate. So, I mean, that's a really, I think that's one of the most important things about this, is because if we just choose to be mad and walk out, the next person is going to have the exact same problem.
Right.
If we choose to go and leave nasty comments online, that's not educating either, and trying to strike a balance between our frustration and our advocacy is where we have to step up, unfortunately. And it's not something we should have to do.
No.
I mean, because a lot of this is just common sense and decency and human kindness, but unfortunately you can't always count on that.
No. And I think back to what we started this whole conversation about, I just truly don't think the adult world, it's kind of how we talk about civilians and the special needs community. The civilian community in their day-to-day life are not thinking about the special needs community. Now, the special needs community are thinking about civilians because we are the ones that are put into their world and are expected to act and do
to accommodate.
So we're the ones always having to, fight and, teach the civilians, okay, wait, but this doesn't work for our child or whatever. And it's the same in the medical world, that the civilian, meaning the adult doctors, not that they're oblivious, but I kind of think they're oblivious to this population because the overwhelmingly majority of their patients are not the new adult special need. Like I said, in adult care, in some of these specialists, you see a lot of elderly patients, but not someone like Cason that has the same health concerns that an elderly person does, right? So these doctors are really thrown off their game when someone like Cason comes into their office. They're not expecting it. Like I said, 9.8% out of 10 of their patients they're seeing that day are not special needs adults.
Right.
And so it's not a priority for them. It's not a priority for their staff to understand it. They're like, oh, we got through that one, but it's not there. And it's, I think, our job as special needs parents to teach these doctors and staff of like, you know what? Yes, Cason's an adult, but you know what? He's really a child.
Yeah.
And this is why we have guardianship papers. And if I told the person at the front desk, no one in the back knows that he has special needs, but can you on his chart write special needs adult mom is with? Just stick a note on top of the chart or type it in. If it's a computer chart that follows you around, type it in. So when that first person opens the door to call us back, knows mom's going with him. And so we don't get off on the bad foot of, no, he's an adult,
Right.
It just lessens the anxiety and stress for us and our adult child.
And I think that the same principles apply when you're at that fourth and fifth appointment and you are building a relationship with a medical professional. I think the steps change a little bit. In your situation where you walked out and never intended to go back, and I don't think you did call them.
I didn't
Actually,
call them.
yeah, but that hindsight, you probably should have. But it's a different situation where if you have decided you are continuing a relationship, then I think you got to talk to different people. If you have developed any sort of rapport, the person I would talk to immediately would be the doctor, the person who owns the practice, and say to them respectfully and candidly, hey, we're repeatedly running into this problem.
Right.
And for your sake and my sake, it's really upsetting to him or her. And it would be very helpful if there could be some sort of accommodation made where there's a note at the front of his chart that he's got special needs and a legal guardian, and that you talk to mom or you talk to dad, boy, that would sure help me out.
Right.
And I think it would be hard for someone to not acknowledge that.
Mm-hmm. And especially if you say to this doctor, we're here because you're brilliant at what you do. Mm-hmm. You're good at being a cardiologist or a neuromuscular doctor or whatever it might be, right? And we value your opinions and education, and that's why we're here to see you. But to make the appointment successful, we need all of this to go well, not just when you come in the room or whatever, because by the time you're the last person we get to.
Yeah.
And by the time, if it's been bad, by the time that doctor or PA or nurse practitioner comes in, Cason is already done.
Yeah.
If it's been a bad situation. And he reads people very well. He's
reading how they read him.
Right.
That's
what I'm saying. Yeah. He senses good and bad very quickly. And I mean, I think of so many situations where I could tell instantly with him. It's a look he gets.
There's the saying about how there are certain animals who can smell fear. I think Cason can smell when you're not comfortable with him.
Yep.
And he can smell when you are. Mm-hmm. And like anybody, he's much more participative and helpful as much as he can be when he feels that you accept him for who he is. Mm-hmm. And that's unfortunate for some of the doctors we have seen, but the ones who have connected with him, we built long relationships with him.
Now, Cason ranks his doctors.
Yeah, he does.
He has his favorites, doctors. And they kind of, depending on what is going on with that particular doctor and him, physically, not like what happened at the appointment. Sometimes they change position, but he has his favorite. And
I mean, a perfect example, his ankle surgeon, and that's been close to a year ago now. But when he went for his follow-up, I mean, I remember him telling me, do you think he'll be impressed that I'm playing soccer? He was genuinely excited about seeing him and telling him how well he's done.
And that he talked about him on the way home.
Yeah.
The second appointment, the first appointment, he was terrified of everything because he was in so much pain, hadn't had surgery. But the second appointment, and he's still asking, when are we going to go see Dr. Zaid again? I'm like, well, we see him in August. It'll be a year. And after that, I don't think you're going to see him again. And he gets this look. And I'm like, please don't break another bone just to go see him. But it's funny, his endocrinologist, who is a pediatric, but she still sees him. And I'm not sure how,
we'll see her as long as we can.
Yeah. Well, has her own practice, so she makes her own rules. But when he was younger, one of the medicines she was putting him on involved a needle, a daily needle. And he let her know very quickly, that's unacceptable and I don't like you anymore. And she still to this day, it was probably 10, 15 years ago, still talks about it because he basically said, I don't like you as my doctor anymore. And it was in a hospital, and we had to walk all the way down to the valet. And he was bitching and complaining the whole way. I don't like her. She's stupid. And we get to the valet.
She's mean.
And
strict.
Gets to the valet, and he's telling this valet that this is a bad doctor and everything. Well, the medicine we ended up only doing like 3 times because it didn't work, and we had to go back to a different med, and that's a whole different story. But we just saw her last week, and she brought that up again. She goes, Cason, am I on your good side now? And of course he is and stuff. But that's just how he is. He moves his doctors around depending on whatever, but he knows his favorites for a reason. They get him and they allow me to be involved in his care, and they don't put stress on him. They talk to him about what he likes, basketball or Special Olympics soccer or
MP.
My possibilities.
What he's doing in his day program.
Yeah, or has he seen a Marvel movie that he, that's when he knows there's a connection there. It's not straight business. And like we said at the beginning of this, stickers and lollipops is a big thing to straight business, but some of these adult doctors will sit down with him before they even do anything medical with him. And they'll be like, oh my gosh, did you watch the Maverick game, Cason? Or, I know you've hurt your ankle, but when can you get back on the Special Olympics team? And I just get that, I smile and I'm like, okay, see, this doctor is making an effort and knows that he is, yes, he's an adult, but he is a child.
Yep.
And I'm going to treat him as a child and as an adult with respect, just like I would any other patient.
Yep. Well, we'd certainly like to thank everybody for their participation on this reel in particular. All the comments were very much appreciated.
And it helps to know that we're all kind of in the same boat, and we all really much had the exact same feelings over this. It's hard.
It's fun. It's fun to see when a small post, a small reel is 90 seconds long, connects with so many people who get a chance to kind of share a common thing that's bothering all of us. Creating that little community is always fun to see happen. So we hope that you got some something you can use here, that you can use at your next doctor's appointment. Just remember, ask your friends for their referrals. Don't ask your doctors. And patience. Let's just all be patient. So,
and always carry your guardianship papers.
Yes, and that's never going to stop. You'll always need your guardianship papers. Yeah. All right. Next week, we're going to talk about a reel that dropped and got about, it was last we checked, it was about 75,000 hits. And it's a tough topic because we're really going to get into the fact that once you find out that your child has these special needs, it really changes the whole trajectory of your life and how people are dealing with that, how you might be able to deal with it, how we've dealt with it.
Right.
So join us next time on Specialness. Until then, I'm Jeff.
And I'm Kim.
And we'll see you next time.